contraceptive pill is a synthetic formulation of the two hormones, estrogen and progesterone, that are produced by the female ovary that play a role in conception. The idea of the pill being to prevent conception. When a woman isn't taking the pill, what happens during her menstrual cycle is that estrogen steadily rises towards the middle of the cycle. So about day 14, estrogen peaks. At this peak, the egg is released from the ovary, and then progesterone rises and takes over, which is involved in maintaining a healthy uterus lining, which increases the chances of implantation of the embryo. The contraceptive pill causes an increase in estrogen, which is actually sustained at a higher level than what would normally be expected. This has been documented to lead to a number of side effects, including tiredness, depression, weight gain, which are a direct result of taking the contraceptive pill. The pill has been documented for quite some time now to lead to an increased risk of deep vein thrombosis, venous thromboembolism, which are basically just blood clots, particularly in the brain, so stroke. Also higher risks of certain cancers, cervical cancer and breast cancer in particular. I think oral contraception is the preferred choice for most women because of three main reasons. The first being reversibility, so they can stop taking it at any point if they decide they want to start trying to fall pregnant. It's less invasive than implants, particularly the IUD, which can be a pretty unpleasant procedure. And it's also much cheaper than a lot of other procedures, particularly the ones that you mentioned, vasectomy and sterilisation. There are two main classes of oral contraceptive. There's the combined oral contraceptive, which has both estrogen and a progesterone in there. There's also the progesterone only pill, which is commonly referred to as the mini pill. And then within the combined oral contraceptive, there are a number of different types. For example, the normal or the regular contraceptive is 21 active pills and 7 inactive pills. Then you have different variations of that, which include Yaz, which is 24 active pills, 4 inactive. There's also triphasic contraception, in which the dose in each tablet varies, which is designed to mimic what would naturally happen in the body otherwise. In terms of ingredients, almost every contraceptive pill has the same estrogen, but the progesterone varies pretty significantly. In my experience in the pharmacy, I see a lot of women who have adverse or negative effects as a direct result of them taking the oral contraceptive. So I think it's important for women to be aware that there are a number of different options available, and that it's important for them to try or shop around until they find one that works best for them. Doctors are influenced by representatives from different pharmaceutical companies, and a lot of the time a doctor will choose a brand of contraception, and then that's what they primarily prescribe for the duration of their practice, for no other reason than whatever rep got in first to influence them in their early career. In the opinion of doctors, I don't think there is enough reason for them to explore different brands. They just choose one and stick with it. They don't really see a reason to switch that, even though the needs of a woman or her specific requirements might change. Doctors don't really see any reason to switch it up from what they know. I think the woman and the doctor need to discuss which brand of contraceptive is going to fit best within their lifestyle. I think women also need to be aware of the number of alternatives to the oral contraceptive pill. For example, implanon implants and vaginal inserts carry a much lower side effect profile than the oral contraceptive, because the ingredients are released locally as opposed to systemically when you take something orally. So I think, it's important for women to understand that the contraceptive pill, while it's the most common or the one most referenced in popular culture, it's not the only solution.